Sometimes I see on social media a question about what settings would be best for occupational therapists or occupational therapy practitioners who are introverted. Or sometimes there's some posts about some students or even like currently in OT school who are struggling and like show signs of like anxiety and doubt about whether or not occupational therapy as a profession is fit for them. I think there's no black and white answer, but for the most part, if you are an OT student currently in a program, it's probably a good idea to finish it. And I've seen in other comments agree with this. You might as well just try your best and just see what it's like. I think the opposite is probably like more like regretful, like not finishing the program sometime in the future and like regretting it. Whereas if you stick it out and you graduate and you get licensed, you could later change careers. However, one important consideration, of course, is, well, tuition, right? And how much debt you will be in. If you're going to be in like a huge amount of debt, which isn't, that uncommon these days with OT programs being super expensive, then that may be a consideration in like dropping out, especially if you just know like 1000% that OT is not going to be for you. You're not going to be able to pay off that debt. And just like the idea of working with any client, the young, the old, and just isn't for you, then you may want to consider dropping out. But before you like just click off on the video, let me give you some just encouragement that may kind of sway you and help change your mind. Maybe just overall help you out, because I myself am an introvert and I've thought about these things. However, I don't regret my decision one bit, even though sometimes it can be tough working in some settings, some days where it just like can be super overwhelming. But overall, it's occupational therapy, as you all know, is like a very fulfilling career. You're helping people. It can be very just rewarding and you make good money and there's a lot of career advancement. Here are some reasons and some settings for you to just consider why OT may still be good for you. Let's get functional. Okay, first let's talk about environments. I'm kind of using like a PEO model here maybe. I'll start with adults and physical disabilities because that's my wheelhouse. Settings that are like pretty intense and hectic and stressful for an introvert is inpatient, so acute care or inpatient rehabilitation facilities. Having worked in these settings primarily, I can say that some days can be like super overwhelming, right? I won't go into all the reasons why, you all probably know, so maybe best to try to avoid this setting. Okay, so then how about outpatient? I think on the scale of environmental chaos, outpatient is a little better in terms of like just the amount of staff and the visitors. However, you can still get a lot of foot traffic, and then like with treatment after a session, like back to back. Also, you may work alongside other therapists like PTs in quite a busy area of other patients. So just in terms of environment, it can be overwhelming, and it may not be that much better than inpatient, although I would say it is better. Okay, how about skilled nursing facility, right? This is a pretty common one. I think SNF is pretty similar to outpatient in terms of environment. Yes, compared to inpatient, it is less hectic, but you do treat along other therapists, and there can be a lot of just going on, like nurses moving around, visitors, right after COVID has kind of opened up, and like just a lot going on. And so yes, while every SNF is different and some are slower than others, you can get a lot of environmental stimulation coming at you. And one thing that's really worth mentioning at this point is really what works against introvert. And these are some concepts. Productivity, right? There's a correlation between higher productivity demands and expectation and higher anxiety and stress, and it's less suitable for an introvert, let alone just an introvert, but just anybody in general, right? Another concept is autonomy. Introverts will probably be better suited in settings where they have more autonomy and less micromanagement. And micromanaging, it tends to be related to productivity, right? So that's another concept, productivity expectations. Of these settings that I mentioned so far, inpatient, outpatient, and SNF, at least for adults and physical disabilities, they may not be the ideal environment. And they have you tend to have little autonomy. There's like a lot of micromanagement and typically pretty high productivity demands, somewhere from like the 85% to the high 90s. And even for like an extrovert, right, these factors can be a lot, so let alone an introvert. Now let's talk about pediatrics. Outpatient pediatrics, I think it kind of shares, just in terms of the environment, these same barriers to an introvert in like the social demands. Instead, I think school OT is actually often recommended, I've seen on social media, as an alternative to settings such as like gyms, private practice, and outpatient, because one, the environment can be controlled by you, in most circumstances, such as like dimmer lighting, the noise levels, right? In pull-out OT, that's definitely the case, right? When you work with them in your gym. But I would know that, of course, in school settings, there is, a other side of it, and that's push-in services where the OT participates and works with the student in the classroom setting. So that can be overwhelming, but that doesn't make up the 100% of your treatment sessions, right? You also have other quiet time, like documentation, meetings, IEP meetings, and things like that. So let's talk about, the PEO, right? The person, right? The client, patient that you treat and work with. So ask yourself this: do you get stressed out more by working with children or adolescents or adults or geriatrics? If you don't do well with like kids, then yeah, well, working with adults will be better for you, and then vice versa. And yes, while working with like pediatrics, you may interact with other adults, such as educators and parents. It's not the majority of your time. You spend most of your time with students in school OT. Okay, so for adults then, well, what setting would be better than the ones mentioned before? I think home health is a pretty good fit in terms of the environment, right? It's often more quiet. You definitely it's more quiet than like a hospital or a skilled nursing facility or outpatient settings. In terms of people, right? It's often just you and the patient, and there may or may not be some family members or some caregivers, but it's just not like a whole like group of people, right? Like there. In terms of like home health, you often have more autonomy, right? You're all the way down to like scheduling, productivity. It's just like much less intense. You have more room and time to like breathe, like in between your sessions, like when you're driving from one patient to the other, to like just kind of decompress. Even if they are back-to-back sessions. And then, as mentioned earlier, you can schedule like your time. So I think that is one benefit, and that may be better suited. Now, of course, home health right off the bat is often not recommended for new grads. So that is one consideration because of the autonomy, right? So it's kind of like two sides of the coin. And I haven't mentioned mental health so far, but this may also be a setting that surprisingly, actually, where some introverts may like better and do better due to the milieu in the therapeutic environment. It's often less, I would say, chaotic than settings in like the hospital or outpatient. Yes, each client is different. Some may be more, reactive behaviorally and just maybe more demanding in terms of like your social expectations and how you interact with them. But it's not like 100% of the time, right? You have often, for example, patients who may be depressed and just less interactive. So you're also not talking all the time and like interacting with them, right? Even if you're running groups, right? You're not expected to talk all the time. You want the clients to participate in, like, depending on the session, they may be doing other things like, right, arts and crafts, music, and just other sessions. Just like, it's endless the amount of things you can do, and it's just not as demanding. So of course, one expectation is that you may be running groups. So if that gives you a lot of anxiety, then may not be for you. However, there are other just mental health settings like community health, right? Community mental health settings where you're working in the client's home that may be similar to the home health side, right? Of physical disabilities of home health, which carries into the mental health side of community settings. So I've done some kind of fieldwork setting experiences with it, and I loved it because it's just like me and my client, maybe like some of their roommates, right? And like other counselors. It's just like so chill, and it's just like it's totally therapeutic. So I love it. Now, last thing to talk about are just other less common settings. And this is just something we may not think about, but it's just kind of one cool thing about OT, how you can jump around. I won't go into too much detail as these are just suggestions and it'll make the video like way too long. And just some settings we don't think about, but they're out there. Let's start with driver rehabilitation, right? It's a good setting because usually it's like one-on-one. You aren't talking like the entire time, especially like behind the wheel, right? You want the patient or the client, to have like focused attention on the road. Right, so driving and commutability may be another good setting. It is a specialized area, but maybe worth considering. Another is like just overall consultation. OT as a role in terms of consult and education, right? So ergonomics, fall prevention, assistive technology, low vision, return to work, such as work hardening and FCEs, functional capacity evaluations. Often these are nice because, well, you have more autonomy, less micromanagement, right? And like less productivity expectations. And you have more time in between your sessions for consultations. Some of these may even be virtual. You don't necessarily even have to go some places, right? Another let's talk about is hand therapy, right? This is another specialty, yeah, so it's more advanced, but worth considering because, well, one, there's less physical demands, right? So you don't have to do things like transfers 24/7, less social demands, like in terms of just like interacting with like other staff, especially like nurses, having to go up to a doctor and talk to them, right? You are just often working with the client. And it's pretty good money and, it's pretty chill. And it's like a really skilled, specialized area where it's like you're working with your hands. I'd say more so with than socially and having to interact. And your therapeutic use of self can go much further because clients often want to get better there. They're like really highly motivated in settings such as hand therapy. So I've been told anyways. Last, let's just talk about one thing I think overall holistically in terms of besides the setting you want to work in is just you yourself and how it can be any job. If you don't decide not to want to be an OT practitioner, you're going to, at the end of the day, probably going to have to work socially to some degree and have some sort of productivity or expectation, right? So it may be worthwhile to seek counseling and therapy for yourself and or medications, right? Such as for generalized anxiety disorder. So don't be afraid to use this service and like just take the time to find a therapist, especially that works well with you, and taking the time to find one. And I've even spoken to some students who personally who have like access to these services like for free, which is really, really cool when they're like a student. And they found it very beneficial and allowed them to like overcome things like failing field work and then passing the second time, or helping them manage their like test anxiety or their shyness and their social barriers. So while overall being an introvert can be difficult in an extroverted society, there are many settings as an occupational therapy practitioner where you can thrive and be comfortable and be successful and make good money as an occupational therapy practitioner. So good luck. Let me know in the comments, what are some settings that I haven't mentioned or reasons why they may be good for an introverted occupational therapy practitioner. Good luck.